So the coronavirus is, well, there's many coronaviruses. So the one that we're talking about today is COVID-19, or the SARS-CoV-2, which is a virus that originated, we think, in Wuhan, China, and is now here in the United States. So it is a virus that is spread by droplets, much like all of the other coronaviruses, and also can be picked up in the environment and spread person to person on hands. So the difference between this and the flu really is a lot in symptomology, and that it's, of course, a different virus. We know with the coronavirus that it's a mild onset for most people. So just, maybe a little bit of a fever, a little bit of a cough over the first week of the symptoms. Then it progresses rapidly for some people. And it's a very small percentage, so somewhere between 15 and 20% will get a more progressive disease where they will become short of breath and potentially have a pneumonia. With the flu, we know that it's more of a rapid onset. So we're looking at an incubation period of like 1 to 2 days. They become sick very quickly, higher fevers, runny nose, sore throat, body aches, cough, and really just those symptoms that we are used to seeing with the flu. And then they'll last for 5 to 7 days, and then people get better. We know with flus, when people get a pneumonia, it would be typically a superimposed bacterial pneumonia on top of the flu, where with the coronavirus it is a viral pneumonia. So we do see a more moderate to severe disease in those compromised populations. So elderly, or those with immunocompromise, or those that have other comorbidities. So we do see that in those populations. But again, it's, that would be day 7, 8, 9 of symptoms when they start getting sicker and start having those pneumonias and shortness of breath. From my perspective, I think that we're doing a good job in a lot of aspects. But I think that people in general can probably take a deep breath and relax a little bit, and really take the advantage that we're given to allow for social distancing. We do have, the kids are home, right? So let's take this opportunity to keep them away from the other kids. We have asked people to practice social distancing. I'm not sure if we're really seeing people 100% doing what they can there. So staying home, keeping your kids at home, no play dates, no sleepovers. Let's limit travel if we can, and limit the amount of people that you're around at a time. We do know that social distancing will work because we know that the spread of this disease is by close contact. So that's within 6 feet of other people. That's, touching surfaces that have been contaminated, and then touching your nose, mouth, or eyes. So if we can work a little bit harder as a community to do the social distancing that we're asking people to do, we can slow the progressive transmission of the disease. So for 80% of us that get this disease, it will look like that. Right? It will look like we're overreacting. But for the 20% of the people that get severely ill, and then the percentage of them that die, that we could prevent some of that, I think it's not an overreaction if you look at it from that perspective. This is it's a virus just like many other viruses that we've seen before. It will cause people to die if they get it, but only certain people. But I think I read somewhere, that only the compromised, that only the compromised could be someone's only. So I think we need to look at it from that perspective, and as being a member of a community, what can we all do to keep our entire community safe? Yes, okay. Yes, I think so. And I think if we look back, we've had other diseases like this too, right? So there was SARS and MERS, and maybe not as many people got sick with it, but it didn't have that person-to-person spread like what we're seeing with this coronavirus. But their death rates were much higher also. So they were more serious diseases, but didn't seem to have that mass hysteria that we're seeing with this now, and I think anybody's going to be scared when they're saying, hey, we're going to close the grocery stores at 8 p.m. or hey, we're closing the bars and the restaurants. But I think a lot of that comes from, people unable or unwilling to create that kind of barrier of that 6 feet on their own, and the public health having to kind of step in and saying, hey, look, if you can't do it, we're going to do it for you. And that I think can sometimes be scary, especially for Americans, because we're used to being, free and being able to do kind of whatever we want. I can speak to visitation. I know that we will be probably increasing our restrictions in the next 24 hours or so. So do look for that and be expectant of that. And remember that it is to protect our staff as well as your loved ones that are here in the hospital. So please do be patient with us as we go through this ever-changing little roller coaster that we're all on together. Elective surgeries, at this point we haven't stopped elective surgeries, but I can't imagine that won't happen in the near future. I'm glad he did it from my perspective, since being an infection preventionist. Again, I think it goes back to whether or not Americans are willing to make the sacrifices that we need to make. And if they weren't seeing that we were doing that on our own, that I guess he had to force our hand to do so. And it's unfortunate that that's kind of where we are right now. But I think if we can all be patient and we can all do the right thing for the next few weeks, then we can get through this crisis together. So at this point, we have basically the PPE, we call them go boxes. Mm-hmm. So if we have a patient that comes in that is positive, they'll have the PPE that is required in there for a period of time. We think it would probably last 3 to 5 days, so that they'll have that available to them. Most of this PPE is standard PPE that we carry on the units anyway, but this would just give them the additional amount that they would need to take care of that patient. We are still looking at taking care of them within individual units so that they can maintain using the negative pressure rooms that we have available already. What I would suggest is that if they are feeling like their symptoms are progressing, that they call our resource line. They can help get them to the right level of care, whether it be their primary care provider, or if they need to seek urgent care, or if they need to come to the emergency department.